This is a presentation on the community analysis of Dunedin, Florida by Crystal King. The objectives, we're going to cover the historical overview, the community analysis such as structure, population, health-related resources, the environment, government and public policy, and then the 6 prioritized community needs. Dunedin is the oldest town on the west coast of Florida, south of Cedar Keys. In 1882, 2 Scottish merchants petitioned to officially name the town that was once claimed to be Jonesboro, now to be called Dunedin, and it was actually incorporated in 1899 to ban livestock from the town. In 1913, it became a major city. The city of Dunedin encompassed both American and Scottish heritage. Dunedin was one of the first chief seaports and trading centers in Florida, with cotton and citrus as the primary sources. Dunedin is a very historic city with a lot of firsts. Frozen orange juice concentrate and sailboat racer called Pram originated here. The PGA, the Professional Golfers Association, started here, and the first radio signals from Pinellas County were sent from Dunedin. Dunedin is on the Florida's west coast, right in the heart of Pinellas County, with an open waterfront that stretches about 4 miles long. Dunedin is a great walking city with shops downtown, festivities on the streets that all lead right to the water, overlooking Clearwater Beach and Caladesi Island. Historic structures in the town help identify, preserve, and promote Dunedin's unique village-like quaintness, character, and charm. The city of Dunedin has kept the Scottish heritage as part of the community. The Dunedin Pipe Band was started in 1964. Dunedin now has a Scottish arts program that begins in Dunedin Middle School, throughout high school, and continues on with adults in the Dunedin Piping Band. Pinellas Trail runs right through the heart of downtown Dunedin. The trail stretches from the north in Tarpon Springs down to St. Petersburg in the south. If you do any riding on the Pinellas Trail, you're more than likely riding on the remnants of the Orange Belt Railway. Much of the Pinellas Trail was built over the railway. Established in 1885, the Orange Belt Railway was the longest narrow-gauge railroad with a main line of 152 miles that carried citrus, vegetables, and passengers. Downtown Dunedin has Main Street, which runs through the center of the city, along with the Pinellas Trail, making it easily accessible to pedestrians, bicycles, individual vehicles, and public transportation. Sidewalks are abundant and crosswalks are clearly marked. The only traffic problem noted are at times of school and business commutes, as well as special events, which are plentiful. Although there are no homeless shelters in Dunedin, the neighboring cities have that support nearby. There are, however, some supportive programs through local churches and provide programs such as Meals on Wheels, Pinellas Hope, Homeless Empowerment Project, and Clothes to Kids. While driving through the city of Dunedin, there are many styles of housing, from mobile homes to apartments, townhomes, condos, and single-family homes. One of the oldest homes is on the Bayshore Boulevard, built back in 1875, that looks out onto the Gulf of Mexico, and it is now a Victorian bed and breakfast, and that is pictured on this slide. Majority of homes were built from 1970 to 79. New construction on apartment buildings are underway on the outskirts of Dunedin. There are 3 elementary schools in Dunedin, which include Dunedin Elementary, San Jose Elementary, and Garrison Jones. Garrison Jones is the only school in Pinellas County that has a dual immersion program from pre-K through 5th grade. The children spend half the day doing work in English and the other half doing work in Spanish. They also have 1 middle school, Dunedin Highland Middle School, and then 1 high school, Dunedin High School. The issue that has been challenged for Dunedin is the preservation of downtown while allowing for development and parking for residents and visitors. Overdevelopment with high-rise buildings are a hot topic for growing areas. However, Dunedin has worked very hard to keep downtown very quaint, Also, the lack of homeless shelter poses a bit of a problem. Here on this slide, you can see the preservation of the house mentioned earlier, and then also a church here in Dunedin as well. Dunedin lacks cultural diversity, with the dominant population being Caucasian at 91%, and the average age is around 52 years old. Poverty level is less than 9%. The top medical issues within the community include cancer, with lung cancer being the most prevalent, heart disease, chronic lower respiratory disease, stroke, and diabetes, which are consistent with the findings across the United States. The top non-communicable diseases were chlamydia and gonorrhea. Rates are higher in Pinellas County than in Florida. The Pinellas County gonorrhea rate were higher than the states, with rates at 140 per every 100,000 population in the county, and chlamydia was 424 per every 100,000. Sprinkled through Main Street in Dunedin are multiple pharmacies, with some that are familiar such as CVS, Walgreens, and Walmart, and a few smaller stores like Wise Pharmacy, which even delivers medication right to the owner's home. East Dunedin Hospital is located a few blocks from downtown, serving the community with quality medical care. Dunedin is lacking some resources such as pediatric care and obstetric, which requires patients to travel to nearby communities. The primary and specialty physicians' offices that accept insured and self-paying individuals, and those that are uninsured and utilize services like free clinics and the public health department would be required to seek treatment in neighboring communities due to the fact that Dunedin does not have any of those services. There are also quite a few assisted living facilities that are for the population that are 62 and older. Costs range from $2,410 per month to $5,095 per month and include a variety of services. Substance abuse has a major impact not only on the individual, but the families and the community. A goal of Healthy People 2020 is to reduce substance abuse to protect the health, safety, and quality for life of all. Problems that are perpetuated by substance abuse include domestic violence, crime, suicide, STDs, and pregnancy. Substance abuse is very prevalent and should be addressed within the community to keep it a safe place. More than 80% of adults do not meet the aerobic and muscle strengthening activities. Utilizing the multidisciplinary approach, it is crucial to improving health and increasing physical activity. Dunedin has the Pinellas Trail, parks, beaches, and shaded sidewalks that are available to enhance physical activity in one's life. Regular activity can improve health and quality of life. It also can lower the risk of disease such as stroke, hypertension, heart disease, diabetes, and early death. Since the publication of the Surgeon General's report in 1964, more than 20 million Americans have died from smoking. Tobacco is the largest preventable cause of death in the United States. Healthy People's 2020's goal is to provide a plan of action to reduce tobacco use to the point it is no longer a public health problem. Pinellas County water supply is managed by the regional supplier Tampa Bay Water. This water supply is unlike any other in the nation because it blends river water, desalinated seawater, and groundwater. The Keller Water Treatment Facility treats and distributes 50 to 55 million gallons of water per day of potable drinking water to more than 900,000 residents throughout Pinellas County. Solid waste is picked up at curbside weekly along with any recyclables. For law enforcement, Dunedin residents rely on the Pinellas County Sheriff's Department. In total, the Sheriff Department covers 141 square miles of land. A wide variety of calls such as burglary, assault, homicide, kidnapping, traffic accidents, vandalism, and trespassing are all prevalent here in Dunedin. Dunedin has 3 fire stations with calls coming through for fires, medical emergencies, and car accidents. EMS services consist of paramedics with Dunedin Fire Department along with Sunstar paramedics. The City of Dunedin operates on a nonpartisan commission manager form of government. 4 commissioners and a mayor are elected by the registered voters of Dunedin. Voting occurs under a staggering system to ensure the city will have a degree of experience on board at all times. The mayor and the city council members serve 4-year terms. With the staggering system, 2 council members and mayor seats are filled, and then in another 2 years, the other 3 council seats are filled. The mayor's responsibilities primarily include attending council meetings to act as the head of the city. The City Council is the legislative and policy-making body and responsible for approving budgets and tax rates. Commission meetings are open to the public and are held the first and third Thursday of every month. Obesity is increasing rapidly worldwide. Obesity is one of the leading preventable causes of death and disability. More than 63% of Pinellas County is overweight or obese. Obesity contributes to so many diseases, so reducing obesity is the highest priority with hopes in improving overall health. 20% of Pinellas County residents are uninsured, with 9% of Dunedin population below poverty level. The need for increased access to healthcare services at a low to no cost is needed within the community to reduce readmissions and mortality rates. With the aging population in Dunedin, a low-income dental program should be implemented to reduce the disease associated with lack of dental care. Chronic lower respiratory disease is the number 3 leading cause of death in Pinellas County. Tobacco is the second leading preventable cause of disease and disability. Decreasing the number of tobacco users is important in decreasing or eliminating the risk of tobacco-associated diseases. Dunedin is known to have a lot of outdoor festivals and markets. Dietary education could be expressed to the public with a booth or booklets to educate the public on proper dietary intake. Important information like shopping on the outskirts of the grocery store, staying away from processed foods, and shopping at a local farmer's market could be discussed. The weight gain starts in the kitchen, so this is a vital piece to reduce weight and disease. Exercise is another piece to a healthy life, so increased physical activity is important in illness reduction. Employers offering a work incentive program or insurance companies offering discounted rates or rewards to those who maintain a healthy lifestyle could greatly enhance active participation. The prioritization was chosen in relation to Maslow's hierarchy of needs, with health, dental, and tobacco cessation being the basic needs, and dietary education and exercise being the physiological needs. Thank you very much.